I care so much. I care so deeply about the patients that I serve and my colleagues and the NHS and the planet that we live on. I just want to do my best. That's what drives me, and the evidence.
And what's your vision? What's the perfect?
I guess everybody being involved and flourishing people, flourishing nature, and health equity.
Perfect. Thanks so much. Sam, you're next on my
It,
screen.
it's about being an effective doctor. I learned years ago when we started bringing complementary therapists into our surgery that what I'd learnt at medical school wasn't nearly enough actually to deliver the care I needed to deliver. And we couched that term 40 years ago, what matters to individuals, not what the matter is with them. So you don't see them as a liver or a diabetic. You see them as themselves. And that's what drives me. And my vision for the future, well, improved health of the nation. Our government should be using the terminology health, health, health. If they did, that would tackle everything that needs to be tackled in our society.
Brilliant. Thanks, Sam. Manal.
So for me, actually, it's quite personal. It's my dad. Unfortunately, my dad passed away when I qualified for medical school, but he was a GP, and unexpectedly at his funeral, 4,000 of his patients came. And that just tells you the impact that you can have as being an anchor in your community. And they came not because, I mean, he was a fantastic clinician, I'm sure, but because he had supported them with all aspects of their lives. And I think that is what drives us all as a purpose. You know, you want to be able to have that impact on your community and and the individuals that you connect with and interact with in life. So that's what drives me. And what would be my vision is that actually after 50 years, this time neighbourhood health finally succeeds and embeds in, and we achieve all of the things that everyone has just talked about.
Thanks, Manala. Thanks for sharing that. That's very poignant and an extraordinary story there. Donna.
I thank you. Thanks, William. So for me, it's about in my role, which is behind the scenes. I'm in awe of all of our workforce that are out on the front line, our doctors, our nurses in our communities, all the people working with our population. And I want to do my best in my capacity to make things better for them and for the population. As Manal said earlier, breaking the norms, breaking the rules to how things are traditionally done. If I can do that, in my capacity to make life easier for our clinicians and our practitioners and our residents, then I'll sit and be happy at the end of the day.